So at this time, I'm going to turn it over to 1199 SEIU United Healthcare Workers East Vice President Roxy Nelson to begin our program.
Thanks, Aaron. Hello, everyone. Okay, awesome. Good afternoon, everyone. Welcome to our roundtable conversation with 1199 Women in Healthcare. My name is Roxy Nelson. I am the Vice President in charge of politics and strategic campaigns for 1199 here in Florida. I am also honored to be serving as a newly appointed member and commissioner of the Florida Commission on the Status of Women. I want to thank all our member leaders who made it onto the call today to share their stories, and everyone here can hear my voice. Appreciate your time and your attention to discuss what we think is some really critical issues. But most especially, I want to thank our very special guests, the members of Congress, Congresswoman Debbie Wasserman Schulz, Congressman Charlie Crist, Congressman Ted Deutch, and Congressman Darren Soto. I want to thank you all for taking the time to connect and to hear workers share about this most important topic at this critical moment for our state and our country. For those of you who are from the news media, if you're on the line, we're starting a little bit later, so our schedule's even tighter, and we want to get done as close to on time as possible to respect everybody's time. So you're not going to get a chance for Q&A, but if you guys request interviews, you can do so with myself or any representative from 1199, from the Caregivers to whomever else. So we're here commemorating Women's History Month. We are certainly, this is a historic time with the COVID-19 crisis. Caregivers, predominantly women, have served on the front lines providing care for others, facing unprecedented challenges that unearthed in the pandemic and exposed and exacerbated all the existing systemic problems that exist in our country and our state, from discrimination, wage discrepancies, and so much more, all by employers who make billions of dollars in profits, even during a pandemic. Our union represents 25,000 healthcare workers here in Florida. The overwhelming amount of those workers are women. For example, 80 to 90% of our bargaining unit inside of the Hospital Corporation of America, HCA, are women. And we know that women are still making 80 cents to the dollar that a man makes. And we know that of 26 or 27% of the women who are employed are in low wage poverty jobs. And we have 5 talented, amazing caregivers here today who want to share their stories with you to sort of shine a light on what they've been going through and to ask for your support to the Congress members and guidance on the ways that our systems of power can help them advance the cause of women working in healthcare. So our intention today is really just at this critical moment to lift up those voices of our caregivers and these magnificent women. So first, I think I'm going to start out by introducing, there are 5 women that are going to be on the panel. Marlon Hoylett and Barbara Johnson, they're both registered nurses from HCA Palms West Hospital in Palm Beach County. Evian Cartamil, a unit secretary at Kendall Regional Medical Center in Miami-Dade County. Letty Loreno, a unit secretary in Osceola Regional. And Linda White, a surgical tech in St. Pete General Hospital. We're going to start with Marlon, one of our leaders and one of the first and many members who contracted COVID while on the job early in the pandemic, when critical shortages of PPE and improper preparation by employers were commonplace. So Marlon, I would love to turn it over to you to share your reflections now.
Hello, everyone. My name is Marlon Hoylett. I've been a registered nurse for over 25 years. I work at HCA Palms West. And I just want to start out by saying, Congressman Deutch, I want to thank you for being on this Zoom video Roundtable today. And I just want to say, I want to thank you for taking the time out to listen to my story. I want to start out by saying I'm a dedicated healthcare hero registered nurse, being on the front line taking care of COVID patients. I in turn contracted the COVID-19 virus, in which I quarantined at home with a lot of fear that my loved ones might come down with the virus. I did not get hazard pay. I only got 10 days of quarantine pay, which was definitely not enough for the sufferation I go through with the virus. For a period of time, I wonder why we're called healthcare heroes. And at the same time, the facility that we worked at really don't appreciate us. During this time, my coworkers work short staff with limited staff on board, and were in the position of contracting the virus themselves. So during this time, it was really difficult for myself and my coworkers. At this time, I want to pass on to Evie that will discuss on PPE.
Evian, are you able to come off mute? Okay, why don't we move on? If Barbara is on, why don't we move on to Barbara? And then we'll come back to Evie when she figures out mute. Help her troubleshoot. Is Barbara on?
Yeah, Barbara's on. Barbara,
I'm on. Hi, everybody. This is Barbara Johnson. I'm a pediatric nurse at Palms West Hospital. I've been an RN since 1981 and with HCA since 1987. I have lupus and can't work with COVID patients, and my facility couldn't reassign me or couldn't tell me that I wouldn't have to work with COVID patients. I wouldn't have to be floated to the COVID units. So I could be safe since I do have immune deficiency disease. After 33 years with the same company, I was off the schedule for 5 months and paying my own health insurance out of pocket. I did get like 2 paychecks for long-term or for time away from work, but then they said I didn't qualify. But I was fortunate that my husband had income so we could pay the bills. But many workers, people working, couldn't afford to miss a paycheck. And healthcare companies that put profits over people should be held accountable. Thank you.
Thanks, Barbara. I'm wondering if Letty's on. Is Evie able to come off mute?
she said her computer is acting up. She's trying to do it on her phone right now.
Okay, great. So we'll go on. So Linda, you want to come off mute and go ahead and you share, and then we'll circle back to Evie.
Okay, yes. Good afternoon. I'd like to thank everybody for taking time to listen to my story. I'm Linda White. I am a surgical technologist. I have been for the last 18 years. I work at St. Petersburg General Hospital. I love my job, absolutely love my job. I love my patients. When COVID hit, it was scary for everybody, but in general, we're used to sacrifice. So we rolled up our sleeves and we just try to get in there and do what we had to do. When they started to ration the PPE, knew that that was something that needed to be done. So we rationed the PPE. We were only allowed to have one mask per day for as many patients as we had. We had to reuse the N95s. We had to reuse gowns. This was all something that we knew that we had to sacrifice because it was a pandemic and we had never been in a pandemic before. But then all of a sudden, the elective surgeries were canceled, and that hit me hard. That hit me where it hurts. Hit me in my wallet. I no longer had a job. I couldn't do anything. The first paycheck that I had, I almost cried because I can't pay my bills on that. The hospital, HCA, they offered us, we could work in any other department whatever hours that we were missing. So I signed up for everything. My first assignment, I was working in housekeeping. I cleaned the bathrooms in the emergency room department. I don't feel like I'm above anything or below anything. I just did what I had to do to make a living for myself and for my family. I'm the only one that was bringing in an income. After that, I was working 7 days a week, sometimes 3 hours, sometimes 12 hours, sometimes 1 hour. I worked screening people in the emergency department. I worked as a babysitter. I worked anywhere that I could work in order to get some money to take care of my family. Unfortunately, I feel very disheartened because we're still under such strict quarantine. They've just only recently lifted the fact that, you know, you can have more than one mask a day, but they're monitoring, they're counting the masks. They're saying that if we are too frugal, they're gonna take the mask away from us. That doesn't make any sense. Also, I've never, ever, the beginning of the pandemic, received a full-time day paycheck. My hours have been cut drastically. I am sent home or canceled at least 2 times a pay period. I'm canceled on Monday. They don't need my services. And for me, it's crazy because I work 6:45 to 3:15, and they told me not to come in until 7 o'clock. 15 minutes, like how much money are you saving for 15 minutes? But honestly, I have not received a 40-hour paycheck since the pandemic. What I want to know is if my corporation is making almost $4 billion in profit and they've made $112 million by not purchasing PPE for us, well, I feel ashamed that they're making this type of money off of my back and the back of my sisters and my brothers and my coworkers. I think something really needs to be looked into. I think that HCA needs to be held accountable, and I think there should be somebody to oversee what's going on in these hospitals and protect us, the workers.
Thank you so much. Excellent. Thank you, sister. Evie, are you able to make the technology work for you?
Yes, I was able to get the technology to work for me. My name is Ivianne Cartamil, and I live in Miami, Florida. I work in Kendall Regional Hospital, which is an HCA hospital. And I wanted to let you guys know that since from the beginning, when the pandemic hit, the first thing that we had the situation with, they took away the masks, they took away the gowns, the PPE from the floors. They were, to me, they were not prepared, and they put us at risk for all those months. And we find that our employer, ACA, actually cut spending on supplies by $112 million in 2020 during the historic pandemic, and that even makes it worse. And yes, I contacted COVID too in May. I was out of work for like a month, and then when I went back to work, I was already working with side effects of the COVID, but I had to go back to work. Healthcare workers are exhausted, and we need help. And I'm, glad to be in this panel to let you guys know. And we need to be protected and respected. because that's the main thing that we don't feel as healthcare workers that is happening at this moment.
Thank you so much, Evie. Thank you, sister. And so I don't think Letty is able to join us today, so we're gonna move on. And I think what we had in mind for next was to have, give the next 10 minutes for the members of Congress to reflect and react to what you just heard from some of your constituents who are all women caregivers working at the largest hospital corporation in the world in a time of a pandemic, who are communicating what they've moved through. And Linda put it so wonderfully, at a time when the corporation is making billions in profit during a pandemic, that workers are suffering through that. So we want to appreciate all the congressional members who are on the line. We don't have a lot of time, so we're asking if each of you take like 2 minutes to react and reflect. Maybe we get a couple of questions in at the end. We'll do our best. But want to thank you guys for serving working families and supporting legislation like the recent American Rescue Plan that was passed. We know that there's lots of money in that bill for states and localities to use for things like making sure there's pandemic pay and hazard pay for caregivers. And so we want, one of the things that we want to say to you is like, how do we make sure corporations like HCA are taking advantage of that and doing what they need to do at the state level to get those resources in to make sure our caregivers are taken care of. But we just want to appreciate you for everything that you do and you continue to do to support 1199 SEIU members. And in honor of Women's History Month, a senior member of the House and a woman who makes and is making history in her own right, would like to ask Congresswoman Debbie Wasserman Schulz to kick us off with her reflections from hearing what the caregivers have to say.
Thank you so much, Roxy, and good afternoon, everyone. It's wonderful to be able to be here with all of you. I want to thank 1199 SEIU for inviting me to this important roundtable, particularly to help commemorate Women's History Month. And I know I speak for so many when I say that I am eternally grateful for your incredible efforts ensuring that our community and loved ones are healthy and safe. I think we've been dealing for a long time with this particular corporation, never mind the pandemic, really not treating their workers very well, and just generally, quite frankly, so much so that that this is not the first time that I have heard complaints like this, even when we're not in the midst of a pandemic. And for me, Women's History Month is a celebration of the strength, dedication, and contributions of women that too often go unnoticed or ignored. And as we're marking a full year since COVID-19 turned our lives upside down, I'm really proud to recognize the women in our community, in our healthcare workforce, who've shouldered the burden of much of this crisis. More than 3/4 of our healthcare workforce is made up of women, and so many of you, as we heard in your stories, have been on the front lines of this pandemic. Every day, you're showing up for work, coping with risks and stress and burnout, continuing to save lives and offer comfort to families that are affected by this virus. So thank you for your courage, your time, and your sacrifice now that we are starting to climb out of this crisis. And I do want to underscore how proud I am that yesterday President Biden signed the American Rescue Plan into law, which will provide millions with necessary and deserved relief. The American Rescue Plan is the most ambitious, progressive legislation in scope and impact since the Affordable Care Act, which I was also proud to vote for and fight for. Congress, alongside President Biden, knows how important it is that we provide vital assistance to our healthcare workers, and especially when so many of them are women. Because so many of our healthcare heroes love their patients, and you're obviously profoundly committed to your jobs, we know, and I can hear in your voices, the utter exhaustion that you have experienced after more than a year of this emergency. And many have gotten sick, and many have died. And others have been stuck with the brunt of home care work and schooling, all while maintaining their demanding paid jobs. And so we have to make sure that we're addressing and fighting for dealing with the shortages of PPE, the inadequate staffing levels, the denials of hazard pay, and other indignities that pushed healthcare workers to the limits during this pandemic. And that's what the American Rescue Plan provides healthcare workers, the urgent relief and support that you need. So just to give you a quick idea of what some of this historic law does, and then I'll close and stay on as long as I can. I have a family emergency that I'm dealing with, so I've got about 15 minutes with you, and then I'll have to jump off. But what the American Rescue Plan does is it extends unemployment insurance, which is an urgent lifeline for so many. It provides a landmark expansion of the child tax credit to help lift children and families out of poverty, which was a provision that we once thought was politically unattainable, but what a difference an election makes. It provides paid leave and funding for OSHA enforcement in high-risk sectors like the healthcare industry. It also includes, and let me just underscore this because I know this is so important, hazard pay as an allowable use for state and local funding. And these are funds that can be used to respond to workers performing essential work during COVID-19 by providing premium pay to eligible workers of the state, territory, or tribal government that are performing that essential work. Or it also provides grants to eligible employers that have workers who would perform that essential work. You've heard about the $1,400 direct payments. We have a new round of state and local funding, thankfully, and it helps our children be able to safely return to school. It also keeps the childcare industry afloat so families can pay for care and get back to work. And it, very importantly, particularly related to some of the stories you just told, helps our healthcare system by expanding coverage, and it leverages the Defense Production Act, which of course the previous president refused to do, to distribute medical supplies and equipment like PPE. So perhaps most importantly, it includes additional funding for testing, contact tracing, vaccine development, public health, workforce expansion, and so much more. I'll just close by saying that it is never okay under any circumstances for a corporation to abuse its employees. And you can count on me to continue to be not just a vote for legislation like the American Rescue Plan, but a voice for you when you're trying to make sure that you have equitable and fair and just treatment in the workplace. Thank you so much.
Thank you so much, Congresswoman. We know that you're dealing with some family stuff, so we appreciate you taking the time to be with us even more so. Can we ask Congressman Crist if he would come off mute and share his reflections?
Yeah, Rock, can you hear me okay?
You're perfect.
Well, I wouldn't go that far. But anyway, it's great to be with you. And I want to thank the 1199 as well. And it's always a pleasure to be on with my dear friend and colleague, Debbie Wasserman Schulz. I've spent a fair amount of my day with her on Zoom calls today, and that makes it a very happy Friday for me. And good luck with the family emergency, Debbie. I hope it's not too severe. At any rate, I just wanted to share with you how important women workers are, literally the backbone of this country, and have made so many tremendous sacrifices in the face of this COVID-19. I hear it in the wonderful women who joined from your sister and brotherhood to explain to us their concerns about what's happening in our hospitals around the state, including right here in my hometown of St. Petersburg, Linda. Thank you for sharing that about St. Pete General. You know, I think that my sister, Elizabeth, happens to be a physician. My dad is a doctor. And, you know, what's happening with healthcare workers and what you do is just incredible. The courage, the sacrifice, the heroic moments throughout this past year dealing with this virus have been extraordinary. And, you know, Women's History Month, we need to recognize that sacrifice with more than just words, but with action. And frankly, that's why I voted for the American Rescue Plan. As Debbie signaled earlier, I call it the Biden Rescue Plan. And thank God for President Joe Biden, Vice President Kamala Harris, and this new administration that actually does care about people. It's making an extraordinary difference for those of us on the call who have had the opportunity to vote for almost $2 trillion of compassion and empathy for the American people during this crisis that we've been in for now just over a year is amazing. And Debbie said it well, elections matter and elections make a difference. And the fact that we worked so hard for the Biden-Harris ticket to win, we're seeing the fruit of that labor right now. And SEIU was a significant part of that. And that's why I'm so honored to be on with you today, to have the opportunity to serve with my other fellow Floridians, Ted Deutch, Darren Soto, and the entire delegation and the great work that they do. They've all taught me a lot. I'm still sort of new to Congress. I only got elected to my third term, and I'm very grateful to the members that are senior to me, particularly my fellow Floridians. that are on with us today, Debbie and Ted. But equally grateful to Darren. Served with him for a long time, both in Tallahassee and now in Washington. I also believe we need to pass legislation that supported unions like SEIU that do so much to protect our workers, workers in the workforce who deal with health care. The stories of Marlene, Evie, Barbara, and Linda are passionately felt, and I think incredibly important, obviously, to all of us. That's why I was proud to vote to pass the Protecting the Right to Organize Act this very week. It's been a big week in Washington and a tremendously successful one for the American people. But that would protect collective bargaining rights for bigger paychecks, better benefits, and safer work conditions that all of you talked about today. So thank each of you for your personal testimony and allowing me to participate this Friday afternoon. God bless you.
Thank you so much, Congressman. If Congressman Deutch is still on the line, would love for you to reflect here.
Thanks, Roxy. It's great to see you. It's good to be with everyone from 1199, and always good to be with my colleagues. Look, you asked me to reflect on what we heard. It's just infuriating to listen to the good people that you have on this call, Marlon and Barbara and Linda and Evie, who for a year who have put their lives on the line and have been disrespected time and time again. It's not right. It's not right that you should have to wear the same mask over and over and over, contrary to what the guidelines are. It's not right that you should be told to use trash bags for masks, that you should have to have homemade masks. Some of the things that I know we dealt with early on. Linda, I think it was you who said that you're used to making sacrifices. There was a moment at the start of this pandemic when everyone came together and recognized the sacrifices that you make. It is, not only is it no different now than it was at the start of the pandemic, we're a year in, the sacrifices you've made are even greater, and we should be even more grateful. So Roxy, I really appreciate the opportunity to spend time with all of you today. Going forward, we have to really push to make sure that the state of Florida makes the funds available to compensate frontline essential workers for the sacrifices that you make. That's got to be our priority going forward, and count on us to be standing by your side, advocating for you. We're immensely grateful for the work that you do every single day. And while you may not get the respect that you deserve every day from your employer, please know that all of us and the people of Florida have that great respect, and thank you every day for what you do. I appreciate it. Thanks, Roxy.
Thanks so much, Congressman. And finally, last but definitely not least, Congressman Soto.
Thank you, Roxy, and thank you to all our women in healthcare professionals on this line. We know that you all have been through so much, that you've cared for our loved ones, some of whom didn't make it, over 530,000 of our fellow Americans, some who survived because of your heroism. You fought through this even though there weren't vaccines yet at the time. You fought through this and saved your loved ones even though you didn't have enough personal protective equipment at the time. And I hope many of you got to see President Joe Biden's speech last night. We know hope is on the horizon, and the American Rescue Act that we just voted on will help us get there, with all American adults being eligible by May 1st. I hope all of you have been vaccinated already. Healthcare workers are already eligible. If you haven't, please do so. It's safe. It will save your lives and the lives of your family members, particularly since we know you're on the front lines. For some of you who have had job losses at some point or even now, or are behind on your bills, survival checks are on the way of $1,400 per individual. We have unemployment at $300 a week until September 6th for those of you who are still unemployed. Food and housing assistance, a record of $50 billion over the last package and this package for housing assistance for so many of you who may be behind on rent. or behind on mortgage. We also have food assistance, including a 15% increase in SNAP benefits. It's unacceptable that any family goes hungry in Central Florida or across our state or our nation. You all talked about not having enough personal protective equipment and about hazard pay. There's over $80 billion in this bill for vaccine distribution, for testing, and yes, for personal protective equipment. We also have over $350 billion for our state and local governments, including in my area where Osceola, Orange, and Polk will get a combined amount of nearly $500 million, both from the state and the local level. And through this $80 billion, both public and private and nonprofit hospitals have the ability to draw down this money to help protect you. It's critical that you work with us to make sure we put the pressure on them to do so. And I can tell you, I know SEIU will be on the front lines with us, making sure that happens. And worker protections, $150 million implement COVID-19 worker protection programs and continued unemployment and worker compensation oversight, and $75 million for OSHA enforcement. There's been no OSHA enforcement up until just recently. This is critical for the workplace. And what a tragedy above all tragedies if healthcare professionals who are out of work can't even get healthcare themselves and health insurance. That's why we have the COBRA subsidy that'll provide for 100% of your healthcare coverage for up to 6 months. Lastly, it's critical that we have our schools and childcare programs funded enough so that many of you who've been either the sole breadwinner or who have had to take off work to care for your children, note that help is on the way. Over $7 billion for Florida schools, over $2 billion for Florida's higher ed education, another $2.4 billion for childcare. We've seen so many women have to leave the workforce to care for their children, and we have to fix that. Lastly, it's about oversight. Serving on the Energy and Commerce Committee, we have direct oversight over hospitals and healthcare and a lot of the organizations we're talking about. So the key is when you see something, say something to SEIU, and we will stand ready to work with you. We plan on going to many of these hospitals, including HCA, hospitals in the district, along with Advent Health and others, to conduct our oversight function over the next 3 weeks of our in-district work period that happens after next week. And we'll be walking hand in hand with you all to make sure that you're treated with dignity, with respect, that you have the resources you need so that we can defeat this virus and get back to normal. And you all are heroes to help us get there. Thank you so much.
Thank you so much, Congressman. We had the intention of giving each of the leaders a chance to ask each of you a question. Quite frankly, you guys answered the questions in your remarks, which was super helpful. I think there's one point, and I know-
You had us at hello, Roxy.
Say that again?
You had us at hello, Roxy.
Yeah, I think there's one thing though I want to frame, and then we'll wrap up, which is the idea that HCA made $3.7 billion in the last year, and that workers are on this call, caregivers, women caregivers, in a corporation that employs 80 to 90% women, talking about not being able to have what they need to do for themselves and their families. One of the questions I think they're wanting to hear from you guys, I guess collectively, is like, what are you able to do? We know that the money's there at the state and local levels for them to access, but what can we count on you to help us do to put pressure on them or educate them about the need to access those funds and for those funds to get to healthcare workers? And so so whoever wants to take that, just what are you able or willing to do as Congress members to support the workers in that effort?
Sure, I'm gonna have to hop off, so I just will quickly answer. I mean, throughout my entire career, I have spent extracurricular time with SEIU, you know, whether it was fighting by your side on the ULIN contract at FLL or, you know, so many other things, you know, days of action where we were pushing and pressuring corporations to act. In this case, actually, because there are resources there that were made available to governmental entities, public entities, and frankly, even, you know, can be made available to employers to pay you hazard pay, for example. We can help advocate. And in every iteration of the COVID relief bills, we've needed to get engaged at the local level to help make sure that we're clear about what congressional intent was for the use of those funds. So we can help you in that way. And then the other important point is, for example, like things with the Defense Production Act, where it is going to be engaged and invoked to be able to make sure that there's PPE being manufactured. Some of the things like that are going to be self-executing, but if they don't happen fast enough, or if the administration needs a push, wouldn't expect that they would, because obviously we're all on the same side now, thank God. But anytime you need us to engage in advocacy, or you need a little push, and frankly, it doesn't always have to be a written letter. Lots of times we can do this via phone calls and other kinds of communication to our friends. So you just let us know, and I'll just close, but before I hop off, and just say, Roxy, I'm really proud of you, and I know the legacy that you're going to carry on from our sister Monica Russo. You learned from the best, all of you did, and I know that the next generation of leaders is going to make her proud and make all of us proud. So
thank you for being with us.
Love to all of you.
Okay, very good. We'll follow up with you. I think one of the things that we want coming off of this call is, specifically around HCA, a letter, phone calls to articulate what we've heard from the workers here today is really critical. So just to wrap up, I don't know if
Roxy.
Yeah.
Sorry, can I just add to that?
Yeah, please.
We've provided $350 billion. Congress acted, the president signed into law, a bold initiative that includes $350 billion in state fiscal recovery funds for state, local, and tribal governments. And that funding is targeted to the pandemic response. And it specifically includes premium payments for essential workers. So the question for our state is, do we respect our essential workers and the sacrifices you've made, and make sure that you're compensated for it? That's the message that I think we have to carry forward now. The dollars are there. We have to all work together to make sure that they get out to help the folks who are on this call, and all of our essential workers, and the many people who have literally put their lives on the line for the past year to help us.
Thank you, Congressman. And we're going to be calling on you all to help us put that pressure on. Congressman Crist, Congressman Soto, anything in parting or reflections on that question about what you'd be willing to do and what types of things you think would be appropriate to help us make the case to hospitals and nursing homes who need to access these resources and do better by the workers?
Well, anything that we're able to do, we're certainly willing to do. And I think it's very important what both Debbie and Ted have already said. The fact that we were able to vote for, and the president signed the bill this week to give help, support, and benefit to so many working people across America, certainly here in the Sunshine State, I think is amazingly important. And I'm very grateful to have the opportunity to cast that vote. And in addition, what Debbie was touching on, there are all kinds of ways to communicate: via letter, via email, personal calls. And I think we can deploy each and every one of those means of communication, Roxy, to make sure that your voice is heard. We are your representatives, literally and by name. And so I know that all of us are more than willing to do that to help you. We are arm in arm with you, and know that always. And God bless you for it. And thank you for the opportunity to share with you this afternoon.
Beautiful. Congressman Soto?
Thanks, Roxy. Whether we're talking about hazard pay or back pay or personal protective equipment or safe working conditions or just dignity and respect, the good news is we're halfway there. We have the money now funded to be able to rescue America, to be able to get out of this pandemic. Now's the other, which is oversight. We have already had meetings earlier last year with my district director going to site visits to different HCA hospitals. In fact, in my office right now, I am a mile away from Osceola Regional. And we had a wonderful meeting with them and heard from nurses from 1199 during that meeting with my district director, Shayla Sensio, being a former 1199 organizer. You all are always in our hearts. But what I commit to you is, in addition to any letters or other statements we need to make, is I'm planning on using these next 3 weeks in our in-district work period to visit various hospitals, among other institutions around the district, to see how implementation of the American Rescue Plan is going. And I commit to going to one or potentially even two of the HCA hospitals in the district to meet with them, but also bring in 1199 into the fold to see if we could work out in person with me in the hospital some of the most egregious issues, like making sure there's enough PPE and dealing with hazard pay and things of that nature. So we're happy to do that. That's going to be part of the oversight power as we all go to the 3-week in-district period after next week to make sure that our taxpayer dollars are being spent to help the American people.
We appreciate the brainstorming. We will follow up with you about the potential meetings, calls, and letters. We appreciate you all so much. Linda, Marlene, Barbara, Evie, thank you so much for sharing y'all's stories. Sorry you didn't get to ask your questions directly, but thank you so much for sharing your stories. They were powerful and really helped us get to the heart of the matter. So I want to thank you guys. Thank you to the congressional members for joining us and being with us today. We will a lot of follow-up here to figure out how we really put some pressure on HCA and other corporations like them to access those resources to make sure they're taking care of folks who need those resources. So thank you all. In closing, really want to appreciate the time spent, and I think that's it. Thanks, everybody.
Thanks, Roxy.
Thanks for joining.
Thank you,
Thanks,
guys.
Roxy.
Ciao, you guys.